busy bringing patients or people that contracted Ebola from the United States to Kenya. Meanwhile, Kenya has had 3 different nurses' strikes this year alone. This is the 5th month of the year. 3 notable nurses' strikes have already happened. And the most important of all was KNH, and I talked about in another video about the significance of KNH nurses going on strike. They have not gone on strike for 7 years. And the reasons that they put for going on that nurses' strike was, number one, was that they were not getting paid. Months would go by, the county nurses of one of the biggest hospitals in East Africa were not getting paid. The other is the ratio of patient-nurse, the ratio of like the patients to the nurses, which is you're supposed to have 1 nurse for every 6 patients, but here they were dealing with at least 32 for every 27 or 32 patients for every 1 nurse, which is, by the way, that is endangering the life of the patient and that of the nurse. You're putting them at risk. You're putting both at risk. Most of them also cited long working hours, which is also pretty normal in nursing. It should not be normal, but it is actually pretty common in nursing. Let me not say normal. But here you are bringing a facility when you are the nurses, where your country nurses are not happy, where your country workers are not happy, and I believe there was also like a doctor's strike as well. Nobody is happy. Nobody can afford healthcare in Kenya, right? Especially with how everybody is unhappy. There is one thing that everybody in Kenya can agree on, which is no one is happy with SHA. No one is happy with health insurance. The public is constantly complaining. The people working for the public are also complaining about the fact that they are not satisfying the public when that is their job in the first place. We sit here and tell ourselves that we work for the people, but we're not doing anything for the people. But you want to bring people from a first world country to a third world country that is actually has had this past 5 years. This past 5 years basically marking Ruto's first presidency as some of the worst times economically, worst times financially. But you want to bring Ebola patients from first world countries to try and treat them. But if we had Kenyan people actually contract Ebola, do you think that the